Hello, my name is Robert Brill. I'm a fibromyalgia advocate and a PhD candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss Tramadol. Is it right for fibromyalgia pain? There are a number of medications that treat fibro pain, like NSAIDs, acetaminophen, narcotics, antidepressants, and the 3 FDA-approved drugs, Lyrica, Cymbalta, and Savella. But what about Tramadol? Tramadol is a fully synthetic opiate agonist and relieves moderate to moderately severe pain as seen in fibro, depression, anxiety, and many other conditions. By definition, Tramadol is a non-narcotic. Tramadol essentially works to change the way you sense pain by working on the mu-opioid receptor, allowing the release of serotonin, and inhibits the reuptake of the neurotransmitter norepinephrine. Tramadol can be an alternative to taking narcotics like Vicodin, for example, for chronic pain, but can still be habit-forming and can cause withdrawal symptoms upon discontinuation. Withdrawal symptoms from narcotics or opioids typically last 3 or 4 days. With Tramadol, though, it can last up to 7 days. This is because of the SSRI-SNRI relationship effect. Tramadol works like an opioid as well as like an antidepressant. Thus, abruptly stopping Tramadol can cause 2 effects. Typical narcotic withdrawal symptoms of flu-type symptoms, seen in around 90% of people, and about 10% of people may experience the psychological effects of hallucinations, paranoia, extreme anxiety, panic attacks, confusion, and numbness. Tramadol is said to be less effective on acute pain versus Vicodin, but more than codeine. Tramadol is contraindicated for use with other SSRI antidepressants because it has SSRI in it, and it can cause an increase in serotonin and lead to serotonin syndrome. Taking Tramadol with Prozac, amitriptyline, erythromycin, and St. John's wort can affect the metabolism of Tramadol and provide a reduced effect. Tramadol is similar to Effexor and acts similar to SNRI antidepressants. Tramadol comes in a few different forms like Ultram, Ultram ER, and Ultracet. Ultram ER is the extended release form of Tramadol. Ultracet is Tramadol with acetaminophen, which is kind of similar to Vicodin, which is a hydrocodone with acetaminophen. The Controlled Substance Act does not classify Tramadol as narcotic today. However, this can change. I actually anticipate it will be listed as a narcotic soon. There are 4 broad classes of opioids. Indigenous opioids, those are the ones produced in the body like endorphins or enkephalins. Opium alkaloids, like morphine or codeine. Semi-synthetic opioids like heroin or oxycodone. And then the fully synthetic opioids like Demerol, methadone, fentanyl, and Tramadol. So what is the benefit of taking Tramadol versus a narcotic like Vicodin? It's hard to find any real solid data explaining how Tramadol is superior to narcotics. Initially in 1995, Tramadol was advertised by its manufacturers as less potent and less addictive than many narcotics. The FDA has since required manufacturers to inform prescribing physicians that Tramadol may be more addictive than originally advertised and also result in more significant withdrawal symptoms than other narcotics upon the discontinuation of Tramadol. I had a physician give me Tramadol about 3 years ago and told me that it's non-narcotic and acts nothing like one, no addiction, no withdrawal. I'm not sure physicians are telling their patients this anymore, since over the last decade there's been hundreds of thousands of reported cases of addiction and significant withdrawal effects with Tramadol. Many people with chronic pain do not respond to opioids or narcotics much. Many do not at all. The population of people often respond to pain-relieving effects of Tramadol where other narcotics have failed to provide relief. My theory about fibromyalgia is to keep trying medications until you can find one that works. So you may find relief from Tramadol. I think the dividing line between Vicodin and Tramadol is this. Vicodin is a bit more powerful, has a few more side effects, and is on the Controlled Substance Act schedule, as are most other narcotics. I just keep using Vicodin as an example because it's the most common one prescribed for fibromyalgia. Whereas Tramadol may be a little less potent than Vicodin, it may have a little less side effects, and it'll actually keep you off the narcotics list for pain relief. Plus, knowing what we know about the efficacy of antidepressants with fibro and pain relief, Tramadol has an antidepressant mechanism which other narcotics don't have, possibly resulting in a dual-action medication, so it provides opioid pain relief and SSRI pain relief. Just as narcotics can eventually work less or stop working for your pain, Tramadol can have the same effect. However, your physician should not hesitate to prescribe Tramadol for chronic pain, since it's not on the controlled substance list yet. Thank you.